Welcome to the EAU podcast. In this episode, UROONCO prostate cancer chief editor Dr. Giancarlo Marra talks to Professor David Penson, the American Urological Association Secretary General, on the prostate cancer highlights of just concluded AUA 2024.
So, dear colleagues, welcome to this podcast. I am Dr. Giancarlo Marra, the chief editor of UROONCO platform on prostate cancer, working in the University of Torino as assistant professor, and I have the enormous pleasure to be here with Professor David Penson, who's the chair of Vanderbilt Medical University in Nashville, Tennessee. And of course, he's also the AUA Secretary General. So I think we cannot have someone who could better than him discuss what were the hot topics and the highlights of the last AUA for prostate cancer. So welcome.
Thank you.
I would directly start with a hot topic. So this year, it was introduced actually a new session, the P2 session, program practice changing paradigm shifting research, if I'm correct, which also had, of course, prostate cancer in it. Several studies were discussed. I think one of the interesting one was a French study, the HIFI study is the name, which is a non-inferiority prospective, non-randomized study. 46 French studies involved, almost 2,000 patients receiving HIFU and 1,300 more or less receiving radical prostatectomy. This was low or intermediate risk prostate cancer. And let's say it's important to highlight HIFU needed to have at least 70% of the gland being treated. Results were quite astonishing because HIFU was actually not inferior in terms of salvage treatment at 30 months, need of salvage treatment with, let's say, some kind of advantages in terms of complication, especially speaking about incontinence and erectile function. So what are your thoughts about this trial?
So first of all, Giancarlo, thank you for having me. The P2, let's take a minute just to talk about the P2 studies, which is a new idea trying to really focus on important clinical trials that are coming out, new reports. And I really thought when we saw that study, the HIFU versus radical prostatectomy study with so many patients and with decent follow-up, that it was something that urologists really needed to know about. Now, I will say that it surprised me because I'm a surgeon and it's taken me a while to come around to focal therapy, but I'm getting there. And I think in the end, we were all sort of a little surprised that there was no difference. And I felt it was really important, particularly for the American audience, to see what had happened in France. I will say the study has some quirks to the design, and I think longer follow-up is needed. But that being said, it really was a wake-up call, I think, for all urologists to start rethinking the role of focal therapy, or at least partial gland treatment, I should say, in prostate cancer, and that it may be a real alternative to radical prostatectomy. The study was very well received by the audience. I really thought it went very well, and I congratulate the authors for what I thought was a very good job.
Okay, so I think we can conclude, of course, as with every trial, exciting new trial that is presented, we need to wait for the final paper, the final publication, and in this case, longer follow-up. But let's say urologists need to open their mind also towards this new technology with this new upcoming evidence.
You know, you and I have talked a little bit. There are people out there who absolutely refuse to accept the possibility that partial gland treatment, or for that matter, focal treatment, should have any role until there's a randomized clinical trial. Well, here's a randomized clinical trial showing you that, partial gland treatment may work.
Perfect. And so another trial which was presented in the same in this new session was the next generation trial, which was actually a a phase 2 prospecting validating paired-cohort trial in which 130 patients underwent radical prostatectomy. But before radical prostatectomy, so before final histology, they had both PSMA PET and MRI for local staging. And again, I think results were quite surprising. We are not talking here about 3,000 patients. It's a phase 2. But PSMA actually showed to be more accurate in predicting identification of final PT staging, which was, by the way, the primary outcome, but also in terms of dominal nodule laterality, which is a good subject coming from a focal therapy trial we just discussed, extracapsular extension, but not for seminal vesicle invasion. So very interesting results whilst waiting for larger cohorts. So what are your thoughts?
I thought that study was really thought-provoking, because if you look at the literature out there, and admittedly the literature out there right now is just okay, they're not always finding differences between MRI and PSMA scan with regard to localization of tumor. And that one really showed that there was an advantage to the PET scan. I think in the end, we're going to end up getting both, and we'll really be able to see what's going on in the prostate. But that begs the question, maybe the one we should be getting is the PET scan. But as you said, it's a phase 2, smallish study, and we need more.
So surprising results, good results, because actually they show there is something that the message we could say is it is at least as good as MRI from preliminary results, but in the end we are improving, so very good, but we will need to wait to a larger cohort to confirm these exciting results. And to conclude, and then I leave to you to highlight what were, in your opinion, our trials, our studies that deserves attention. Another study that got my attention that has been presented was the study the INAPA study that was presented by Neil Shore in the same session, in which again it was not a randomized trial, but patients with high-risk localized prostate cancer were given apalutamide 12 cycles in combination with IDT, so 12 months. And impressive, at 2 years, BCR-free survival was 100%. So again, not randomized, not 2,000 patients, because the amount of patients was relatively low, but promising for the future. I don't know what's your quotes.
If I remember correctly, that study was adjuvant enzalutamide, if I'm not mistaken.
Exactly.
And I think it's a interesting study, but you have to remember that what's your endpoint? It's PSA, and I'd like to see a different endpoint down the road, whether it's metastatic free survival, retreatment, because even though the testosterone levels have gotten back to normal, it may be in a year or two the PSA will come up. That being said, that study, I think, speaks to what I think is coming down the pike. And there were studies presented at AUA as well, which is here we have this in the adjuvant setting. What about the neoadjuvant setting? And to me, that's where this gets really interesting. We also had a session at the AUA around what we call clinical trials in progress. So ongoing trials that have not reported out yet, but are either in the process of accruing or completely accrued. And Neil Shore had a study there as well, looking at enzalutamide in the neoadjuvant setting. So similar design, randomized to neoadjuvant enza versus standard of care. And it strikes me that we're going to see the neoadjuvant setting, maybe more so than the adjuvant setting for a lot of these trials. So it's an exciting time. And I think that's where we're really going to, that trial got me thinking about the neoadjuvant space. And I just think all around high-risk prostate cancer, we're going to be seeing neoadjuvant and adjuvant treatment. It's worth talking a little bit about the clinical trial session as well, only because there was some other really interesting stuff coming down the pike there. Jim Hu presented an update on an ongoing trial looking at the ratio-sparing hooded technique versus standard radical prostatectomy. And so I'm really interested in that because that's a big deal, I think, on both sides of the Atlantic. But the other trial that caught my eye in the clinical trial setting was Ted Schaefer's PREVENT-2, which is again looking at transperineal versus transrectal biopsy. And you know at EAU, Bader Mayan presented his pro-PC results in the game-changing session. And I think this is a really hot area, and we're going to see a lot more in both AUA, EAU, and hopefully in all the journals that are going to drive us with biopsy. But I have to say that it was a really good meeting. The International Prostate Forum, as usual, was terrific. I was at the EAU for the prostate cancer sessions, and they were great as well. It's a great time to be in prostate cancer, you know?
Indeed. So this everything is changing, and we have some new teams, neoadjuvant, some old teams, transperineal, which is a never-ending story. But maybe this year with a PREVENT-2, with a Translate trial, which is another big trial from the UK, will come to an end. So we will leave this, I think, for AUA next year and EAU next year. And thank you very much for discussing this with us and for giving us the insights of the interesting session and highlight session on prostate cancer for AUA. Thank you for being with us.
Thank you for having me.
Thank you for listening to this episode of EAU Podcast. To keep up to date with prostate cancer developments, visit our educational platform, UROONCO Prostate Cancer. For more EAU podcasts, please go to your podcast app and subscribe to our EAU podcast channel for regular updates.